Remember to focus on communication. Remember to focus on communication. Communication. Alright, we're gonna talk about stress and coping. None of you ever have stress, right? So anyone know what the types of stress are? Did you know there's types of stress?
No.
What does eustress mean?
You're stressed out at yourself.
What? Anyone know? Like eustress, like EU stress. It's like good stress, right? So you need a little bit of anxiety, stress in your life to help you be successful. Okay, some of you might disagree with that, but some of you might get a little test anxiety, right? Or new situations, you get a little anxious. At that thing last week, they made people sing and get up in front of people. When I make you guys do the box, you get a little bit of stress, right? But does it drive you to do better in front of your peers? Sometimes, right? So there's good stress, bad stress. So we all need a little bit of stress. But when it comes to the point where it's taking over our life, that's when it becomes an issue, right? So an external focus or influence that disrupts kind of our body's normal homeostasis. So how we behave, how we act normally, right? Okay? So how many of you feel like this more than this, like zen ah? Some people have a higher stress level, more anxiety level, just on a normal basis. Some of us are more like zen on a normal basis, right? So a lot plays into that, how well you can cope with stress, or what your coping mechanisms are. So what are some ways you guys cope with stress? Sleep. He sleeps.
Take a walk.
Okay. Exercise for some of you probably. Read. What are some other ways? What about boys in their own? Video games, okay, kind of like check out from reality for a little bit, maybe. Anyone else? What are some like unhealthy ways to cope? What? Oh, I thought you said cleaning. Drinking, okay. So a lot of people turn to substance abuse or drug abuse or unhealthy habits, right? When they can't cope or can't deal with their stress or how to cope. And sometimes that comes from how they were raised, right? You guys have heard me say over and over, neglect, trauma, not a great childhood. If they grew up in an environment where there was no coping skills, a very high stress environment all the time, what do you think that person is going to be like as they grow up? Same, right? High stress, they won't know how to cope with it. Might not have any coping mechanisms. Okay, so when we're dealing with patients who seem stressed, which anytime anyone's in the hospital, do you think that they're more like this or more like, oh, I love to be here, right? Nobody says, sign me up to put me in the hospital. I'd like to spend a couple days there, right? It's a stressful environment. People don't sleep there. There's people they've never met in their whole entire life poking and prodding at them, asking them all these questions. It's not a calm environment, right? Yes, it's a safe place, we know that as nurses, but for the general population, it is a very scary place to be, right? So when people are inpatient, they're under a huge amount of stress. So this as nurses, we need to keep that in mind. So we all have some stress in our life as we mature, called maturational stress, so stress across your lifespan. So obviously when you were a kid and you went to school for the first time, how many of you remember your first day of school? Like I can vividly remember getting on the bus and going to kindergarten. I was scared, right? I can seriously remember that. It was thousands of years ago. Not thousands, but a very long time ago, right? How many of you remember your very first day of school? Some of you, right? Maybe our childhood was more stressful. I remember like standing on the bus thinking like, how far can I run before my parents will catch me, make me do this? Like I did not want to go to school. It was terrifying. High school. For some of you, it might have been the transition into middle school or into high school, right? Those are just common, or maybe coming to college. Then by the time I went to college, I was like, heck yeah, get me out of here, right? I was ready to go. But there's different points in your life that cause you higher stress than others, right? Not new knowledge. Okay, so it's how you deal with these time points in your life and how well you cope, and based on who's with you for that journey, right? You have a great support system, a good coping mechanisms, you'll do better through these points in your life, right? You guys are coming out of a very stressful point in your life, graduating nursing school, taking that big exam, starting your brand new nursing job, maybe moving away from your peers, moving away from this group of people you spent a lot of time with in the last 2.5 years, right? Not gonna need to see me anymore. Right? A lot of stress is happening soon. Good stresses, but still it makes probably someone be very anxiety. So how do you deal with those stressors? What in your environment, so outside of just your internal stress, is affecting that stress and how you cope with it, right? So those of you that have good coping mechanisms, have a great support system, you will probably do better moving through some of those stresses. Those with less coping mechanisms or not as healthy, you might struggle along the way, right? So we know when we think about our patients, you guys have seen this before, right? Maslow's hierarchy of needs, the NCLEX talks about this, they refer to this. We know that if people's physical needs are not met, so if you're sitting here this morning, you're tired, you're hungry, you're probably not listening to me very well, right? True story. Your physical needs aren't met, you can't perform or be as engaged as you'd like to be, right? Same with your patients in the hospital. They're hungry, they're tired, they're in pain, they don't feel well. They're not themselves, right? They're under a great amount of stress. So until we kind of meet their physical needs, maybe it's a simple thing as, hey, you drink Coke every day. Would you like a Coke with your meal, right? Sometimes it's simple things as nurses we don't always think about to meet their physical needs. They have to feel safe and secure. With mental health, if somebody's suffering from mental health, do you think they feel safe and secure in their head? No, absolutely not, right? So if these needs aren't met, they can't continue to move up and meet all these things, and their stress is going to continue to increase. Love and belonging, if they don't have a great support system, right? Patients who have to navigate the health system alone, it's a very scary thing, and it's very, very stressful. And as you guys get more seasoned nurses, you'll sometimes forget that the general population doesn't have the knowledge that you guys have. So as nurses, it's always important to remember, like, they have like an 8th grade knowledge or less, maybe when it comes to the healthcare system. So you have to be able to meet all their needs to truly take care of them, right? So we know stress is kind of a hard slide to see, but we know it can act on our whole physical body, right? If you're under a lot of stress, do you get changes in your skin? Maybe acne when you're younger, dry skin, itchy skin, right? These things can happen. Respiratory, for people who suffer from extreme amount of stress, maybe it affects their breathing, right? We know that if the immune system gets worn down by stress or other things, people are more prone to illness, more prone to chronic illnesses if they don't take care of themselves in the long run, right? Lead to metabolic disorders, so thyroid issues, diabetes, all these things, right? Not new knowledge for you guys. In extreme cases, if people are under a high amount of stress or they have some major life event that has happened that has dampened their immune system enough, sometimes they end up with a cancer diagnosis or a terminal diagnosis, long-term diagnosis from that amount of stress. Okay, they can have a lot of GI problems, right? Some of you might have this if you're stressed enough, your gut is not in the right place, right? Okay, pretty common. And then other things, you can get body aches, fatigue, all those things. So we know, like I just said, chronic exposure to stress increases your susceptibility to illness. It can affect caregivers. It can affect nursing professions. So if you're ever taking care of a patient who is very angry or screaming at you or just really not acting like themselves, maybe they're just under a lot of stress and they don't know how to cope with that. And unfortunately, you're the target that deals with that. So as nurses, we have to remember that a lot of times anger comes from fear, a place of fear, right? Think of the time you've been like really, really upset about something. Was there a fear factor connected to that? Okay, if patients are in the hospital and they're screaming at you, maybe they're just terrified that they're going to die, or that now they're gonna have to deal with this new diagnosis, or they don't have money to pay for the medication. Maybe they're afraid they're gonna lose their job because of they're in the hospital, right? So stress can be a huge burden and a huge impact that I don't think we always take into consideration when we're taking care of patients. And if our patient's having a bad day or an off day, maybe it's just because we're not meeting those needs, right? Or there's something lacking, or they never really learned how to cope, or they can't cope with what's happening to them. Okay, as nurses, you guys are gonna feel like this, probably. I'm fine, you're fine, everything's fine, right? I say fine a lot. Some days I feel like this, right? Like, it's all gonna be okay, right? You have to be able to take care of yourself to take care of others. We've already hit on that soapbox quite a bit. So if we don't, unhealthy things will happen to us. It can lead to long-term anxiety, trauma. So what are some ways that we can assess patients and know how well they're dealing with stress or not dealing with it? What kind of questions can we ask them? What do you guys think? How would we know if they have good coping mechanisms? Can you tell just by looking at somebody? You don't know them? Like strangers? Can you tell if your patient's able to cope well or not? Maybe, maybe not. If they've seen you in bed crying, sobbing, looking at the floor, they're probably not coping very well, right? Or they have something else going on. But if they're smiling, put on a good face, but not really talking to you, are they coping well? So what kind of questions can we ask them? How do we truly assess for somebody's stress level? What kind of things can we ask them? What do you guys think? Okay, anything new going on in your life? What else can we ask them?
How do you handle stress?
Okay, how do you deal with stress? On a scale of 1 to 10, you can use, just like we use the pain scale, right? On a scale of 0 to 10, what is your stress level? What makes it worse? What makes it better? Right? Same when we assess pain, we could assess stress. Right? What helps? Is this new for you to be this stressed out? Or have you, in the past, if something goes array in your life, do you feel this way? What are some physical things they might present with if somebody's really not coping well or really under stress? How might they physically look or act? They might not have an appetite, okay? What else? What about like vitals? They might have an increased heart rate. Their blood pressure might be high. So sometimes you can think about this like acute pain, right? Somebody's in acute pain, their heart rate can be elevated, their blood pressure can be elevated. If they're really in a lot of pain, their breathing might be different, right? Somebody's extremely stressed, could they have those similar symptoms? Absolutely, right? Now, if they're just mildly stressed, it really shouldn't affect their vitals, right? But it might affect their mood or their behavior. So we really need to think about that when we're taking care of our patients. What about their color? Like, do they look pale? Do they look flushed? Are they sweating? Are they diaphoretic? And if there's no really physical reason why they should be exhibiting these things, maybe it's just the underlying stress on their body, right? So what are we gonna do for somebody who has extreme stress or extreme anxiety? CBT therapy, try to get to the bottom of it, what causes their stress. Maybe try to help give them some healthy coping mechanisms if they don't have them. Ask, how do you cope with things in the past that didn't go your way? Or how do you cope with things when they stress you out? Okay? And if in extreme cases where somebody is really stressed and it's really affecting them, we can turn to drugs. But obviously we're going to try to do everything first. Provide a calm environment. Talk to them. See if they have good coping mechanisms. But if not, we can give them benzos. So alprazolam, your PAMs, right? Lorazepam, diazepam, anything to kind of help calm them down, right? If it's a long-term issue, and they have some underlying depression that's maybe making their stress worse, maybe they need to be on an antidepressant. Maybe nobody's ever addressed their depression or their feelings of hopelessness, sadness, those things. And now they're in the hospital and it's kind of making their stress worse. Okay, so we need to do a good assessment of that. They can give them tricyclics. So what do we know about tricyclic antidepressants? They're not used as often, but sometimes they're used with people with a combination of depression and anxiety. So what do we know about tricyclics? Orthostatic hypotension is a big one. If they have any sort of cardiac history, you want to use caution because the way it's metabolized sometimes can affect their cardiac and sometimes cause arrhythmias in certain patients. So they're not usually the drug of choice, but sometimes for mild depression with some anxiety, they will pick a tricyclic or an SSRI. And then sometimes they'll use SNRIs as well. Because usually if it's stress with depression and it's not bipolar, like they're not super erratic, then they're dealing with multiple neurotransmitters. So it's not just serotonin. A lot of times then they'll give them like an SNRI or a tricyclic or try multiple drugs, right? So let's talk a little bit about phobias. Any of you have a phobia? You're afraid of something.
Yeah.
What?
Yeah, I do.
Yeah.
Like an actual phobia?
Yeah.
Yeah, vomit.
Oh, that's a weird one that I've not heard. Heights. Okay. Anyone else?
Small spaces.
What?
Small spaces.
Small faces. So claustrophobic. A little bit. Is it more like claustrophobic or just like being stuck in a small place and you can't get out?
Mhm.
So like you never take the elevator.
Oh, I do. It doesn't take long. If I got stuck in there, I'd
Yeah.
be
I'm
done.
not a big elevator fan. A little bit of claustrophobia. Anyone else have any like weird phobias? Spiders. Arachnophobia. Any other weird phobias? Somebody last year was like had a phobia, like really fearful of like taxidermy, like stuffed. Like you could never go into Cabela's, that would totally freak them out. I won't tell you who that student was, but like snakes. Like I'm like deathly afraid of snakes. Like my hands are sweating right now just thinking about it. But I grew up in an area and where we had a lot of rattlesnakes, so like the fear of God was put in us. Like if you see a snake, it's going to kill you, you'll die. Like my heart is racing right now. Seriously, I hate snakes. Any other weird phobias?
Frogs.
What?
Frogs.
Frogs? I like
Mhm.
frogs. Little innocent frogs. See? Everyone kind of has like these weird fear phobias. So if you have a true phobia, sometimes it's a dysregulation of these 3 neurotransmitters within your brain. Or if you see that, your brain might release extra of these, or it might depress them, depending on what your situation, right? So somebody who has a fear of heights, if you were thrown from a building as a child and suffered trauma from that, you probably would not produce dopamine when you think about that, right? Or it would suppress your dopamine because you have a negative connotation to that. Like kids who've been through a traumatic situation where they were like attacked by a dog as a child, right? They might have a true phobia of like animals or dogs, and it truly probably affected some of those neurotransmitters in their brain because it was traumatic enough, right? So here's some other ones. Acrophobia, agoraphobia, arachnophobia, so spiders, fear of flying. People who have hematophobia, fear of blood. Hopefully none of you have that if you're going to be nurses. Although vomit, so you might see a lot of vomit. I have to work on that. So what do we do with people who have these like intense fears? Now some people just like don't like things, but if they have a true phobia where it takes over their life. Like I took care of a patient once who hadn't left her house in like 5 years because she had such a phobia of leaving, like going outside. So her sister brought her groceries, like she never left her house. And then she ended up very sick, ended up in the ER, and she actually died 2 weeks later of lung cancer, very sad because her phobia came true. Like she thought if she left her house, she'd die, and she did. Doesn't normally happen. But what do we do with these patients who have like this phobia so bad that it truly like interferes with their day-to-day life? Okay, we can do intense therapy. If it's bad enough that it causes them severe anxiety, so like the person who's going to leave can't leave their house, they might get to their front door and freak out, right? It might raise their anxiety so high that they can't do it. So you might have to give them some benzos. They might have to be on antipsychotics, SSRI. It kind of depends on how their phobia makes them act. And then therapy, so CBT. We have to try to change like the thought process that this fear is not so bad that it's going to kill you, right? So sometimes they'll use what's called desensitization therapy, where they'll put them in this intense therapy where they have to visualize what they're scared of. So they kind of put them in this state of fear, and then they talk them through it. So it's kind of like this show that used to be on, like Fear Factor, right? Where they made these people face their fears face on to see if they could overcome them. Now, if they put me in a pile of snakes, I would probably have a heart attack and die right there. I might go into a catatonic state, literally. Right? Like for some people, I don't think that's the right type of therapy. But sometimes they'll try to use this desensitization where they make them face their fear, and it kind of makes their brain like realize, okay, you can go through this fear and it doesn't have to ruin your life on a day-to-day basis. Now that's people with like extreme phobias, like they can't leave their house. So maybe an intervention for somebody who is unable to leave their home would be, okay, by next week you're gonna stand by your front door for 10 minutes and take slow deep breaths and visualize yourself walking through the door and write down how you feel when you're visualizing that. Like what are you feeling in your body? Right? And they kind of help them process through that of, okay, take deep breaths. I see myself touching the door handle and opening the door, right? Sometimes that will work. And then maybe by the next week, it's you have to put one foot outside. Like feel the air from outside touching your skin. You're okay, right? See how this desensitization works? It's a very in-depth process. Very, very tiny steps to meet a overall big goal to let them leave their house. Maybe by the end of the month, they make it out the front door and are able to stand on their step with the door closed without their heart racing. So a lot of intense therapy for people who have true phobias that kind of take over their life. Now, if somebody has panic phobia, this potentially can become a medical emergency. Have any of you ever had true like panic? To where like you can't breathe, your heart is racing, your world goes from seeing everything that's going on to seeing like nothing. That's like true panic. Your heart is racing, your body is going to start shutting down, and they can start to hyperventilate. All these things can happen. Like true panic disorder can be a medical emergency for some people. It might mimic like a physical problem, like having a true heart attack for some people. So what do we do if somebody's having that? Calm them down, okay? Sometimes we have to medicate them, give them a benzo, right? Anti-anxiety. Sometimes we just have to sit with them until they're kind of through it. Just sit calmly, be beside them, say, I'm here with you, I'm going to talk you through this, stay calm, right? Focus on your breathing. Some people with true panic disorder or true panic phobia, or where they're thrown into a panic response, if this is something that takes over their life, they'll do what's called like stop therapy. So they'll wear like a rubber band on their wrist or something that they can snap themselves, because if you're doing this, it focuses your brain to a different spot. Or they'll tell them to pinch themselves, because if they're pinching themselves, they're causing pain, right? Your brain can truly only focus on one thing at a time. And if you give it enough pain, it's going to focus on that over other things. So if somebody's really freaking out and they start pinching themselves and kind of focusing on, okay, I'm pinching myself, that hurts, I need to calm myself down. It's a way to kind of make their brain divert to say, okay, I have to think about something else. Let's calm my breathing. So sometimes you just have to sit with them, stay with them, ask open-ended questions, and just try to develop some sort of rapport and make sure they're safe, right? Now, if they're to a point where they're really freaking out, you might have to give them some meds to help calm them down. And then kind of stay with them and work them through it. Okay? So, agoraphobia, people don't want to come out of their house, fear of places or situations. We give them anti-anxieties. Other phobias, depending on what their trigger is. Maybe it's anxiety, maybe it's depression, maybe it's a combination of both. Maybe it's they had some sort of trauma related to this phobia as a kid. Like maybe they're extremely scared of clowns, right? There's a lot of people who are scared of clowns. What is that called? What is that phobia called? Yeah, I can't think of it either. Anyway, fear of clowns, it's a very common thing. So maybe they've had a very scary thing as a kid with a clown. Who knows, right? Maybe their parents took them to the circus and it was terrifying for them. Okay, so we're gonna find out kind of what the root of the problem is. How are we gonna help them deal with it? Social anxiety disorder. This is where people have a phobia of other people or being made fun of by other people, ridiculed by others, enough to where it impacts their day-to-day, right? Maybe they can't go to school, or they don't want to go to school, or they don't want to go to their job. They can't hold a job because they're so fearful that everybody makes fun of me, or they're constantly judging me. Now, everyone probably has a little bit of this at those points in your life, right? You're coming to a new school. You probably had this when you started college year, like, who's gonna be in my class? Who are my faculty gonna be? Who am I gonna sit by, right? Like, a little bit of that is okay. But if it totally impacts their day-to-day life, then it's a true disorder, where they can't socially be around other people because it causes them great anxiety. So then we have to do, again, that desensitization. Make them realize, like, people aren't scary. Social situations are not scary. So for them, group therapy might be an end goal for them, right? You're gonna start with individual therapy, help kind of get to the root of the problem. Why are you so anti-people? And then how can we change the way you think to change the way you behave? CBT therapy, right? And then eventually we're gonna get you to sit in a group and be comfortable. Desensitization. Okay? So let's do this question. A client arrives at the emergency department in a severe state of anxiety because of a motor vehicle. So this is, they had a situational problem that led to this. So what are we gonna do? Somebody's totally freaking out. What are we gonna do? First, we just need to remain with them until they're calm, right? Because if they're freaking out, are we gonna be able to teach them anything at that point in time? Absolutely not, right? It's kind of like if you're ever, you guys have, a lot of you saw people having babies, right? They teach people Lamaze, right? Like when you're going to have these contractions, how to deep breathe, and how to do all this in a focal point and all this stuff. But when you are having true contractions and a baby's trying to come out, screw Lamaze, right? You are gonna be like out of your world whack, right? So, is that a point where you're like, okay, now's the time to teach you deep breathing? No. Don't say that to your wives, men in here, when you get married and have kids. They're gonna punch you in the face. Okay? It's a time to just be like, I'm here, what do I need to do right now in this situation to calm you down first, right? So anxiety sometimes relates to pain in a lot of ways in how we deal with it, okay? So many times in an anxiety crisis, just be there for them. Calm them first, then we can worry about teaching them, right? Okay? Let's talk about anxiety. This is a good lead into it. So anxiety is a stress response. So people who have a high level of stress can turn into anxiety. I'm sure some of you have anxiety. Anyone want to admit that your anxiety affects your day-to-day life? Some of you, nothing wrong with that, right? It's part of your physical makeup, chemical makeup, how your brain reacts to situations, or how you've dealt with situations, or how you cope. It can have similar kind of side effects related to depression, and so a lot of people who suffer with anxiety, they'll also deal with depression, because it's kind of this like teeter-tottering effect to try to find their homeostasis, their equal balance, right? Some people just have anxiety, some just have depression, some have levels of both. Okay? They might have a feeling of helplessness. with anxiety, constantly worry. Okay? Good, you guys can admit it, nothing wrong with it. So, who is susceptible? Anybody, everybody, right? It can stem from your environment. So a lot of stresses within environment that can cause anxiety or play into people's anxiety, right? You guys agree with that? Lots of things in the environment and the outside world. I feel like the media, for people who are anxious and constant worriers, the media has made it worse, right? Social media is not a friend of people who struggle with like social anxiety or anxiety in general for several reasons, right? So there's individual factors, there's physical factors, or there's also a chemical imbalance within the brain. Or how well your brain can handle and deal with stress determines how maybe much anxiety you have or don't have. And sometimes it's just the way people are wired, right? I'm a very calm person. I have a daughter who very much deals with anxiety on a day-to-day basis, and she's 10 years old. And some days I just want to shake her and be like, it's okay. Like, the things you're worrying about, it's okay. But I have to realize, like, her brain is not wired like my brain. Okay? So it can start at a very young age as well. So you have to understand, is it something in their environment? Is it something in their past? Did something traumatic happen? Neglect, abuse, trauma, no coping mechanisms? Is it something they've always had? Was their brain just wired this way from the start? And they're forever going to have a little bit of this worry and anxiety. And if so, then we need to, are they able to cope with it, or do they need help coping with it, okay? Is gender a significant factor? What do you guys think? Do you think males, females? Do you think it's more females because they're more apt to show their anxiety or more vocal about it than males? What do you guys think, males in the room?
Probably.
Yeah, in our culture, unfortunately, men are told you have to be strong and tough and kind of have this certain, like, masculinity, right? Like, don't show weakness. And so they might really be struggling with anxiety, but might just process it differently. Would you guys agree? Not saying any of you have it, but I would say there are some males that very much struggle with anxiety, but they're more likely to internalize it. Maybe not be as outward with it as sometimes females are. Which might just be a ding on our society in the way that we have the stigma we've kind of put on the male emotional state, right? Okay? So both depending on when we can get it. So again, if they have constant worrying, a part of their brain called amygdala is your worry center of your brain. So maybe that part in their brain is just wired a little different than those of us that are born this zen, right? Just genetics can play a key part into that. And I told you my daughter is very much an anxious person. My husband is a very anxious person. His family is a very anxious people, but they are more internal anxiety people, where she's a more external anxiety person, okay? So do they have any history of abuse, any sort of major trauma, neglect, anything? It always goes back to abuse, trauma, neglect. Did anything in their past happen that has kind of changed or damaged that part of their brain to where causing this anxiety, or is it just their upbringing? Do they come from very anxious parents? They might be very anxious kids, right? Is there other things that are playing into this to cause anxiety? Sometimes we have to try to figure out what is the bottom cause and what triggers it. Okay, so anybody who worries a lot or has anxiety, what causes it? What makes them feel that way? Or if you start feeling anxious, what do you do to help that? Maybe they don't know how to help it. Schools, a lot of schools now are teaching kids how to deal with anxiety because it's becoming such an issue where kids can't sit through the day, or they're struggling with learning, or their grades are being affected, or they're starting to notice a change with how they interact with their peers because of anxiety. So they're starting, a lot of guidance counselors are getting a lot of training on ways that you can help kind of calm down this internal feeling of worry and problem, right? Okay, another form of anxiety that kids get is separation anxiety. So this happens around 2 years age of life, which you think about development. That's when kids start to get a little bit of dependence, but they're still pretty dependent on their parents. It becomes an issue when the anxiety lasts longer, 6 months or longer. So kids that maybe have trouble in school, they have extreme fear of something bad happening to their parent or their loved one and they're not with them, might struggle from true separation anxiety. Adults can have this as well. What kind of personality disorder do you think that some adults might have that also have this? What? Dependent, yeah. People who have kind of this dependency of, I constantly have to have someone else with me, maybe struggled from separation anxiety as a kid, or maybe they still struggle with it as an adult. This kind of fear of like, I can't be alone. I have to be with someone all the time, or I can't function. So sometimes they'll have both, kind of a dependent personality and this separation anxiety. So it can put them at risk of developing a personality disorder later on, or some sort of anxiety disorder later on. These kids might have extreme nightmares, not be able to function in school, constantly be worrying through the day of, where's my mom, where is my parent, where's my sibling, is something gonna happen to them, just kind of this constant worry. And it can be very hard for them to live their day-to-day when they're constantly worrying as a child. Okay, so how do we prevent it? How can we prevent anxiety? Can you prevent anxiety? If somebody's brain is truly wired differently, can we prevent it? Probably not, right? So how can we help them deal with it? So maybe journaling is effective. Maybe ask them, what is your coping mechanism? Do they have a good coping mechanism? Do they like to exercise? If so, maybe they go and exercise to burn off some of that energy when they feel extra anxious. Or do they like to read? Do they like to sleep? Do they like to play loud music or just calming music? Or do they not have a good coping mechanism? Maybe we have to help them find that thing that will help them cope. Maybe they have to count to 10 or do like stop therapy where they snap their wrists, right? They pinch themselves. In schools, they teach kids to press on their fingers and count to 10. Do this and see if it helps you feel calm. Like really think about pressing down on your hands. Does it calm you down? Maybe, maybe not. Okay, seek help early is the biggest thing, and recognize that it's okay to have this anxiety and it's okay to seek help for it. I think that's where we lack is people who are super anxious or super worriers all the time. We want to just tell them it's okay, stop worrying, right? Those of you that have anxiety, how many times in your life have you been told that? Like, it's okay, stop worrying, it'll be fine, right? It's fine, everything's fine. Well, to them, it's not fine, right? They have this internal struggle going on that is affecting their day-to-day. So how can we do better to kind of help some of those feelings of anxiousness so that they can function on a day-to-day basis? What tools can we give them to be more effective? What has worked in the past? Has anything worked in the past? Have they ever sought out talking to someone about it? Is there any life event we can relate to this anxiety? What triggers it? What causes it to come on? Okay? Children, maybe it's they saw a traumatic event. Maybe it's their genetics, the way they were raised, the way their parents behave. Maybe it's the way their brain is wired. Maybe it's the environment they grow up in, socioeconomic status. If they grew up in a bad neighborhood or poverty, they raised themselves. They maybe didn't have a parent right home with them after school to give them love and nourishment and talk to them about their day. Maybe that affects their overall anxiety, right? Older adults, they can have cognitive or physical impairments from it. Significant emotional loss might cause them anxiety or significant changes as they go through life, right? Okay, so levels of anxiety, there's different levels. So how would you guys describe these? What do you guys think? So mild. So what if somebody called me right now and said there's an active shooter on campus? Okay, some of you are like, holy crap, I'm panicking, I'm getting out of there. Some of you might have a little bit of like, is this for real? Is this fake? Like, should we go look at the window? Should we shut the door? Should we cancel class? Some of you might have a little bit of a racing heart, right? Anyone ever been in a situation where there's been an active shooter? If you have, you probably have more anxiety than if you've never experienced that before, right? Or say somebody said, Farty started the lab on fire, there's a fire downstairs, you gotta get out of the building. What if when you were a child, your house started on fire and you woke up in the middle of the night with flames? You might go into severe panic, right? So depending on your life experiences of these things, might be how you can handle it or how you can deal with it, right? So mild panic or mild anxiety, you usually start to have a little bit of an increase in your sensory perception, okay? So you might start to, instead of just being able to know what's going on in this whole room, it might just kind of, your focus comes in a little bit, right? You might be more alert, okay? If I said there's an active shooter on campus, you might become very much more awake than you were 2 minutes ago. You might be listening, do I hear like anything in the hallway? Do I hear doors slamming? Do I hear anyone yelling, right? You might be more alert or more aware of your surroundings, right? You might start tapping your foot or fidgeting a little bit, okay? Or if I said, okay, everyone putting everything away, we're gonna take the test today, right now. Okay, some of you might start, your heart might start racing a little bit. You're like, are you serious? Like, I haven't studied, right? Some of you might start crying. That might be leading more to moderate, right? A little more moderate anxiety, okay? Your perceptual field might become a little bit narrow. What about your vitals? Are we still pretty normal vitals? Yeah? Okay. Let's go back to our active shooter. He's coming up the stairs. There's somebody on the stairs with a gun right now. Where are you guys at? Like, if this was truly happening, would your heart rate start to race a little bit? I would hope so. I might panic because I have to protect all of you, technically, right? Or just be like, I'm out of here, guys. You're on your own. Okay? So, the more severe it gets, the more we're going to see changes in vitals, right? Your heart rate's going to rise, respirations might climb, or initially you might start to kind of like clam up a little bit. Palms are sweaty, you might become diaphragmatic. Your attention span might become very short, right? If I say there's a shooter in the hallway, are you guys going to listen to anything I'm saying from that moment on? No, you're like, I'm out of here. I don't care about anxiety. Get me out of here, right? Okay, some of you might be shaking. Now what if the shooter walks in the room? Okay, some of you might be screaming, some of you might be freaking out, some of you might be sitting in your chair unable to move. So where are we at in this now? Severe, or some of you might truly be panicking, right? Some of you might be racing out that side of the room. Some of you might be flipping tables over and trying to hide underneath them, right? Okay, what are your vitals going to be like then? There's someone with a gun right out here who wants to kill us. Anyone's heart rate racing? What? Your feet. Okay. They might have palpitations, tachycardia. Some of you might start to hyperventilate. Some might have this feeling of impending doom, like, oh, here we go. This is it. Like, tell whoever you love them, right? It's been nice knowing you guys. Right? Anyone feel that? I'm really not morbid, but I'm trying to get you guys in this mindset. Okay? And then this shooter comes in and is waving a gun in front of you. I would hope you guys are panicking at this moment, right? Severe panic. How does somebody feel who has severe panic?
Fainting goat.
Are you going to be able to focus at all? What did you say, Tracy?
Fainting goat.
What?
The fainting goat.
Yeah, some people stop dead in their tracks, they don't see anything, they don't concentrate, their heart is racing. Your body might just totally shut down, right? Same with panic. You know, this is what happens when it's truly panicking. Their body might just shut down. They might have very bizarre behavior. They might be screaming, they might be hyperventilating. They might not be able to physically get up and move from their chair. I might say, Cindy, get up and move. There's a shooter coming. You're like, I can't, Cindy, I can't. Right? Am I wrong? Not saying that would be you specifically. What about their pupils? We did Perla. Wait, let me stop and do assessment real quick before you shoot this person because I want to know. Okay, we did Perla. What would that look like? Well, yeah, their pupils are going to be dilated, right? They're not going to be constricted, they're going to be dilating. Heart's going to be racing. Okay, so generalized anxiety disorder. So somebody who has constant worry. Excessive anxiety for at least 6 months. So these are people that are going to need treatment to function on a day-to-day basis. So this is where their anxiety went from a little bit of constant worry on a day-to-day to where they can't function in society because their anxiety is so bad. So they can't relax, they maybe can't sleep at night, their brain is constantly racing, they can't shut it off, they're always kind of on this high alert, and they have this fatigue because they never really are able to kind of relax and calm down, right? They might be extremely irritable, partly from lack of sleep, partly just from this feeling of like constant worry, constant nagging at them, right? So last greater than 6 months is your key there. So how are we going to treat them? How are we going to help them? SSRIs maybe. They might need some anti-anxieties to use PRN when they feel kind of this extreme anxiety, right? So they might have benzos. And that might be the only thing that works for them. They might have to be like on a mood stabilizer. They might have to be on like an SNRI, right? To kind of calm their norepinephrine down. That's your fight or flight, remember? So these people will have like extreme norepinephrine. So I might need to calm that down. It's more of an SNRI for some of your atypicals. What kind of therapy would we have to do with them? What do you guys think? CBT. You don't know, say CBT. It's probably right. That's what they do for everybody, right? So we're gonna give them drugs. We're gonna help them get through this. We already talked about separation anxiety. I don't know why that slide is not in there. Now? Come in here. Who got the box? Sydney, here you go. Communication.
Yes.
Are you okay?
No, I am not. Well, okay, that vote
Here's your
gave me
nurse,
anxiety. I was like, oh my god.
Is there an active shooter in the building? We just talked about that.
No, there's not. But I'm still very nervous.
You're the nurse.
Because I can't get a hold of my daughter, and she was supposed to drive to some falls today, and I'm just really nervous about it. I'm sure what if she's laying in the ditch somewhere? She doesn't wear her seatbelt. I mean, I think she does, but I tell her she should.
Do you have her location on your phone?
No, I'm not that crazy.
Is she with anybody?
No, she's by herself. And the weather is supposed to be bad. They say it's supposed to be raining. I've been busy at work. I can't get a hold of her dad. Like, why is this my problem? Like, I'm always checking in on her, but I don't have Life 360.
Honestly, I don't know what to say to that. How do you
Softball.
know when she's expected to
Focus
be
on
there?
communication. Focus on what's happening. So how do we redirect this to Cassie, not her daughter, right?
How was your day today?
Really terrible.
What else are we gonna do? What would you guys do? Help her out.
I would probably have her sit down.
Okay. Maybe pull up a chair. Would you like to sit down?
Does this happen often?
Okay. Does it happen often? But what do we need to find out first, maybe? Like, would we want to say, Cassie, you seem like you're pretty upset about this. Has this ever happened before? How are you feeling right now? Does that make you feel calmer? Maybe, maybe not, right? Might not help, okay? They might be like, don't use your therapeuticness on me right now, I'm freaking out. Okay, so what are we gonna do? What are we gonna do, guys?
Just sit and talk to them.
Okay?
Distract them from the
Do you wanna
chat.
sit? Maybe do you wanna go, should we walk in the hallway? Touch. Does this help calm her down? Maybe, maybe not, depends on your person. Now, if they're pacing and they seem to be getting more aggressive, we probably don't wanna be like, okay, coming in on you, right? You might get punched. So what are we gonna do? What are we gonna do? How are we gonna talk her down? How are we gonna talk her off the sledge?
Breathe.
Okay, deep breathe, distraction. We might have to distract her. Stop therapy, right? Okay, pinch yourself or take some deep breaths. Count to 10. Has anything worked in the past? What has worked in the past for you? Okay, thank you. Okay, anything else you guys would say or do? Anxiety is hard because we want to be like, tell me more, tell me more, tell me more, but telling them more might actually kind of heighten the anxiety, right? If she continues to talk about her daughter, that's the trigger, that might actually make her anxiety worse, right? So do we need to distract her? Like, how do we get her to kind of change this mindset so we can calm her behavior down? Anxiety is kind of hard to deal with. You guys will deal with patients who are very anxious in the hospital setting. And sometimes you don't have very much time to kind of be able to talk them down, to de-escalate their anxiety, right? So how else can we make that happen? What else can you do? Somebody who's truly anxious. What if they're having a panic disorder? Okay, so this is the most severe. Panic disorder, panic attacks, panic, anxiety. So sudden attack of terror, accompanied by pounding heart, sweating. They could pass out on you. They could become very dizzy. They might experience chest pain, nausea, vomiting. It might mimic like they're having a heart attack. So if you work in the ER and somebody comes in and they're having these symptoms, you first have to rule out anything physical, right? Because maybe they truly are having a heart attack. Or what if you've had somebody who's had 12 panic attacks and they're back in your ER for the 13th time? Do we still do an EKG and still rule out that it's not cardiac first? Yes, we do. Because guess what? That number 13 times is when they're actually gonna have a heart attack. And then it's you realizing, oh, she's back again, having another panic attack. Right? We'll see this in practice. You guys will see this, but we have to rule anything physical first. Sometimes people who struggle from panic attacks, they have this intense worry of, is it gonna happen again? Right? Somebody who has like a true panic attack where they're hyperventilating, they can't function, their heart is racing. It doesn't usually happen at home at night in their bedroom, right? In their privacy. It's gonna happen somewhere that triggers their anxiety. So usually those are social situations, right? Or maybe out in public. Or maybe they're at a restaurant and it happens. And they're surrounded by people and now they feel this coming on and they feel like, oh my gosh, I'm gonna have this great panic that comes on, I'm gonna start sweating, I'm gonna have chest pain, I might throw up, like I can't function, I can't see. And then they have all this intense worry about their panic attack and it's like this vicious cycle, right? So how do we truly help somebody that has this? What do you guys think? What can we do? Help them understand what triggers it to come on, right? Because if they can understand that, if they feel like this aura or feel like it coming on, then maybe they can prevent it from becoming so extreme. Okay, so if we know what triggers it, what kind of tools can we give them to maybe lessen the severity of it? Make it more moderate attack versus full-on panic. What kind of things could we tell them? Maybe desensitization will work, depending on what is triggering it. Maybe they need to go to some counseling and help them learn some coping mechanisms or way. Maybe they don't know about stop therapy, or like count to 10, deep breathing, right? Whatever works for them to try to lessen this before it becomes a full-on panic disorder. Okay, more women than men are diagnosed, we already talked about that. It's one of the most treatable anxiety disorders if it's correctly diagnosed. So they can treat with therapy, they can treat with meds, and they can teach them these coping mechanisms of when you feel this coming on, of how to deal with it. Not to say they're never gonna have anxiety again, but at least they can deal with their anxiety with a combination of meds and therapy to where it won't impact their day-to-day life, is the overall goal, right? So, I don't necessarily love the statement that it more occurs in the home or community, except for in the hospital, because you might see people in the hospital who suffer from severe anxiety from panic. They're in a very stressful environment. So that stress in itself might make them go into severe panic. Okay, it might mimic physical symptoms, right? Their heart might be racing, their respirations might be erratic, they might be sweaty. And maybe you just think, oh, it's part of why they're in the hospital. But maybe we need to think about, okay, is there something more than just this physical symptoms going on? Have they ever had panic attacks before? How is their stress? How well do they cope with stress? Has anyone ever addressed this before, or is that what's happening? They just can't deal with whatever is going on, or why they're there. So get to the bottom of what is causing it, okay? Help them see that there's positive outcomes, right? Like if we can help control your anxiety, you'll be able to handle your day-to-day environment, right? You'll be able to go be with your friends. You'll be able to be in these social situations. You can function better on a day-to-day basis, right? Instead of this internal struggle. Okay, so obviously there's no specific lab test. What we rule out, is there any physical illness? So cardiac, do they have any sort of hormone abnormalities? Is it a thyroid problem? Is there some metabolic issue going on? Is there something else going on? If not, we can refer them to a mental health professional or ask, have you ever sought any therapy for this before? Would you be willing to talk to somebody about your anxiety? And maybe help them understand, maybe they're too afraid to go to a counselor, or they think that therapy is useless, right? So we have to sometimes try to educate them the benefits of helping themselves and getting help so they can better their overall health, right? And then if we do need to give them pharmacologics, we can give them benzos to help calm them down when their stress is extremely high or they're in panic mode. SSRIs are sometimes the better choice. Sometimes they'll use buspirone, Buspar as the other name for it. It will take 2 weeks to take effect, so it works a little bit quicker than some of your other SSRIs. If they have extreme anxiety where they almost have like psychosis from it, they can use antipsychotics. Or if their anxiety is bad enough, they sometimes will use like mood stabilizers to help calm them down. Obviously, with antipsychotics, we have to be cognizant of neuroleptic malignant syndrome. There are your signs and symptoms up there. Sometimes they'll put them on beta blockers. Why would you think that would be? Think if somebody is extremely anxious, how are their vitals? Extremely high, right? So if we put them on these meds, it kind of helps calm them. They can get kind of this major flushing effect or have kind of mass vasodilation. So sometimes they're on a beta blocker to kind of balance that out at a very low dose. It helps with the side effects of some of their anti-anxiety meds. That kind of all of a sudden calming them so they don't get this rapid kind of vasodilation effect. Makes sense? So then they can do CBT. We can do other things, yoga, acupuncture, journaling. Again, has anything worked in the past for them? Have they tried anything in the past? What do they like to do when they're feeling their best? That's a really good thing you can ask anyone in mental health. What is something you really like to do when you're at your best? Right? If they like to exercise, okay, let's just walk then. We don't have to full-blown exercise, but let's just walk. If they like to read, okay, let's just maybe look at some very simple terms and you tell me the word, something to distract their brain that relates to something that they like to do, okay? Journaling can be effective for them if it's something they like. Maybe, or you can ask them, how would you relieve just normal stress in your day-to-day? And maybe you can tie that into something to affect them. Again, do they have any other illnesses that are playing into this? Any other meds? Any past stressors? How did they cope? Did they know how to cope? Any past trauma? What was their upbringing? What was their childhood like? What were the major, you can always ask people, what were the most stressful events in your life? Because maybe something during that time period is what is triggering this overall anxiety, okay? Maybe they don't want to talk about a loss in their life, but if you say, what, tell me the most stressful times in your life, and maybe they say, well, dealing or getting rid of my child's stuff after he died. It's a different way to get to the bottom of something, right? Maybe they don't want to tell you they lost a child, but their most stressful time in their life was going into their kid's room after he died. Okay, very traumatic event. So maybe try to reword your questions so to get them to open up, right? Use your therapeutic communication. All right, why don't you guys take a break? We'll talk about crisis, trauma.